our notes. This is going to be interesting today. So you may want to split your screen right now so that way you can engage in the Pear Deck as we're going through it. There's not audio on each of the slides because I'm doing the audio with you right now. So do make sure that if you're taking your notes with me right now, that you go back to that Pear Deck and you engage in those visual slides. I'm feeling pretty good today. All right, so I'm going to start with my notes. So we are going to be talking today about professionals and professionalism in veterinary medicine. I have no idea who all those people are, so I guess that's not very professional that I'm showing an image of people I don't know. But that's what we're going to be talking about. So I really want you to start thinking about what types of things you think of that are professional and what are some things that you think of that are not professional. All right. So a few things that we want to know about veterinary medicine is it actually is a newer kind of field. So in 1960 is actually when the profession began by Walter E. Collins. And so he started the veterinary technology in North America. All right, so that's when we start kind of getting more of a field for veterinary technicians. In 1989, the animal health technician became formally recognized as veterinary technician. So it wasn't very long ago that vet techs became a thing. So it's still a very new career field. And today now there's hundreds of programs that you guys can go to, and we'll actually be hearing and talking to a few of them throughout the year. So it's kind of crazy, right? So what, 30, oh my goodness gracious, 40, 60 years ago is when the vet tech program started, or not even started, but when we started having assistance to those veterinarians. All right, so some of the roles that we can find at veterinary clinics, there's a whole bunch of things that we can find. This information is also in your textbook, so I want to make sure that you are aware of that and review your textbook information when you're filling out your study guide. So a few different things. You can find students, right? So you can find people that are doing their internships. In the veterinary world, we don't call them internships, we call them externships. So you can find people completing their externships. Those of you that are interested in a second year vet assisting opportunity that is in the works, please reach out to me if you are, but do know that it is going to be a grueling acceptance process because we cannot take all of you, and you need to definitely show that you are in for a challenge. It is most likely going to be a hybrid type program, but we will be assisting and placing you with real work experience, but it's going to be very difficult. So it's not going to be easy, just to kind of throw that out there. But we do call them externships. So it is an externship when we see students. You might find some groomers at a veterinary facility. Some of them have them on site. Kennel assistants, receptionists, office managers, practice managers, hospital administrators. The office managers, practice managers, you may or may not see. Receptionists may or may not be cross-trained as a kennel assistant or even a vet assistant. So I want to break down those different roles that you're going to see. So again, we're doing Cornell style notes, right? So the left-hand side is everything in the white and the right-hand side is everything in the black. This is going to help us study later on, so that way we can kind of fold over our paper and have the definitions, and then we're just going to go straight across. So student is the first bullet point. So students are volunteering their time. Do not expect to get paid for your externship. It will be an unpaid voluntary thing. With the pandemic, that has changed a few of the externship opportunities, so it is going to be a little bit more difficult moving forward, but hopefully everything will go back to normal, or at least whatever the new normal is, and we can get externs back out there. They are going to assist when and where directed, right? So an extern is not going to be doing surgery their first day out. They're going to be shadowing for a while, and then have a set of skill lists that they need to accomplish, right? So tasks they need to get done. Groomers, they are what you think of, right? So they're going to be cleaning, bathing. We are seeing many more people grooming their own animals, or then you see all the groomers in the pop-up like PetSmart, Petco, and things of that nature. You just got to be kind of careful with the groomers that you go to, because they are doing some different procedures that may or may not be needed. as far as like expressing anal glands, and then you don't know how they're doing it or how they were trained. They actually have online grooming programs, like you can get certified as a groomer online. I don't know how that works if you've never groomed an animal, but you know, it happens. And then we have our kennel assistants. I highly recommend you guys start looking for jobs as kennel assistants. It's the best way for you to get experience and for you to get into these facilities. There's quite a few facilities that are very large that have kennels where they're boarding animals on site in the veterinary practice as well. So you get in as a kennel assistant, and then you let them know by the way you work that you are awesome and that you're a hard, dedicated worker. So kennel assistants responsible for cleaning, feeding, walking. They're possibly responsible for hiding medicine in food for the animals, maybe even giving some medications depending on what it is and how long you've been a kennel assistant for. All right, then we have our receptionist. Many facilities will cross-train receptionists and veterinary assistants or technicians. That way we have the most people that are able to kind of work with our clients. And especially now we have drive-through or drive-up facilities. So it's really important that we have that person on the phone. They are handling the transactions. They're handling that client communication. They got to be positive. They have to be upbeat. If you are a grumpy person, you're going to learn real quick that that's not going to work in vet med, right? So the thing that pays your bills in the veterinary facility is not the animal. Like, unfortunately, the animal cannot just be like, oh, my paw hurts, and then give you like a credit card for you to treat its paw, right? It comes with a human. So that human is going to be that thing that is paying, or that person rather, that's going to be paying that bill. So the receptionist is that front line communication with the client. So that impression is really important. All right. We also have office managers, practice managers, hospital managers. Your textbook rearranges them this way. Different facilities will call them something different. Some facilities will even have like a tech manager that is responsible for all the technicians. So don't Google search it, right? You got to look at your textbook, because your textbook is going to have the information that I am teaching you from. So office manager is going to work to ensure front of house is running smoothly, right? We talked about the front of house the other day. So they're going to make sure everything is good. The reception's good, everything's clean, people are getting records filed, appointments are getting managed properly, and things of that nature. Your practice manager, you think about, is going to oversee all the employees, scheduling, and possible discipline that needs to happen in the facility. So practice managers are generally on site. Your hospital managers, however, can be off-site. They're going to run behind the scene things. So things that the billing, the hiring, the firing, double checking, ordering possibly, building maintenance stuff. So that could be like even your HR person as well, could be your hospital manager. So they may or may not be on site. Okay. Now we are also seeing a switch in veterinary medicine where we have a medical director. So that is one of the veterinarians acting as a medical director. So that's some new lingo that's not in your textbook, but you're going to start to see that as you go into industry. All right, so now this is the nitty gritty, right? This is what we really want to know about, is the veterinary healthcare team. So these are the people that are going to be first contact with the animal and the client and seeing what's wrong, right? Actually starting to fix it. So we have our veterinarians, we have veterinary technician specialists, you have veterinary technologists, you have veterinary technicians, you have veterinary assistants, and you have laboratory animal technicians and technologists. That's a mouthful, right? So depending on which of these you're interested in, your book again is going to go into far more detail than we're going to cover here. So I do suggest that you read over that. We are going to talk specifically about veterinarians, veterinary technicians, and veterinary assistants. Technologist and technician may just be a matter of a different degree. And specialists are going to start to specialize in things. So there are some of you that really want to work with exotic animals. So you start to specialize in exotic animals. There might be some of you that really, really, really want to work with anesthesia and work in surgery. So then you could start to specialize in that, okay? So before we kind of go into what those different roles are based off of some of the things you can do is based off of the supervision of the veterinarian, okay? So when we're going to start talking about what I can and cannot do in a facility, right? Like an extern versus a vet assistant versus a technician. I need to see what my supervision is. So I have immediate supervision is that licensed veterinarian is in direct eye contact with you, right, or direct eyesight. They're not staring at you while you're drawing blood, because then you wouldn't be able to draw the blood. But so that licensed veterinarian must be within eyesight and hearing range of you. So immediate supervision, like you are doing whatever you're doing with that veterinarian right there. Then we have direct supervision. This is when that licensed veterinarian is just on the premises. They're available, right? So maybe you're in the back, you're in the treatment area, you're helping out a technician, and then the veterinarian is in the exam room and they're doing their own thing, right? Like they're examining, they're talking to the client, you're in the back helping somebody else. So that would be direct supervision. We have indirect supervision, where a licensed veterinarian is not on premises but maintaining direct communication. This would be something that wouldn't happen very often, but sometimes if there's a shift change going on between doctors or an emergency comes up and your facility is left without a doctor but you have technicians there, that would be that indirect supervision. Technicians can do nail trim appointments, so that might be something that, the doctor's not there yet, but you're doing some nail trims. Basic care of animals, feeding, cleaning, and watering. That would be the role of your veterinary assistant, okay? So our veterinary assistant is going to take care of those basic animal feeding things. They can give medication, but it needs to be under direct supervision. And then they can restrain during exams, and they can also pull blood. Now, when we talk about pulling blood, I'm not just taking a vein and pulling on that vein and trying to get blood out of it. I'm actually taking a needle and a syringe, and I'm going to be inserting that needle and syringe into the vein and then pulling blood out. I'm pulling off of the syringe, so therefore I'm pulling blood. So that's where that comes from. So that's your veterinary assistant. Veterinary technicians, on the other hand, they have to complete and pass a VTNE before they are licensed, registered, or certified. Now, so in a vet assistant, I don't need to have a whole bunch of schooling. I do need to take some classes. I do need some animal experience, but I don't need to pass any tests. So I can go, depending on what state I live in, vet assistants are not necessarily certified. That's a newer thing that's happening in the industry. But I can just walk off the street, learn how to be a vet assistant, and they can train me. So that's that assistant piece. Veterinary technicians, though, have to have some sort of training and a degree. So they will have a degree. They have to complete that VTNE, or that veterinary technician national examination, before they can be licensed and registered. And that is a pretty difficult exam to pass. So you definitely want to make sure that you're studying very well for that. This is not an easy program. Veterinary technicians, they get to run the diagnostics. So they get to run the lab work. So that assistant pulled the blood. Now they're going to give it to the tech, and the tech then gets to put it into the machine. They're also going to be assisting in clinical and surgical procedures. So your technician will be there in front of the lines with your veterinarian, helping them out. So our requirements for our education requirements for our vet tech. You do need to attend a community college for an applied associates of science in veterinary technology. That's the bare minimum, right? So you do need to go to college. At least a 2-year degree is an applied associates of science. Now we'll talk about some different programs that have some different requirements. So if you're looking at JJC's veterinary technician program, they run a 2-year program, but you need to have some general education requirements before you get into the program. So you're looking at more like about 2.5 to 3 years to complete that full process. Versus there's a place called Fox Tech College in Tinley Park, and they run an 18-month CVT program, or vet assistant vet tech program, and they put their English and math classes within that program, right? So you're taking English and math while you're taking your animal classes. So they're two very different programs. We'll see if we can have representatives from both communicate with us somehow virtually. Now each state is different. They do have some different course requirements. So if you get licensed in Illinois, you're not going to necessarily be able to be practicing or licensed in Ohio. Right now, you can be referred to as a CVT, which is Certified Vet Tech, which is what we are in Illinois. You could be an RVT, which is a Registered Vet Tech. You can be an RAN, which is a Registered Animal Nurse, which is, we're pushing for that in Purdue. Purdue's really running that campaign really a great deal. is kind of pushing for animal nurses. There is one issue with that, though, is that our human nurses are like, hey guys, like, you're not nurses. So that's a whole kind of debate too, because we don't call our animal doctors, we don't call them animal physicians, right? We go to human physicians, but we don't call them veterinarians. So our veterinarians are veterinarians. So depending on your viewpoint, it makes sense that they wouldn't be animal nurses, but you can find a different name for it pretty much in every state. So there's also LVT, which is licensed veterinary technician. So lots of different places with that. Also, depending what state you're in, like, so Illinois, we're horrible. We're not horrible, but in Illinois, we will have a vet assistant who doesn't have a college degree do some of the same stuff that a vet tech would do. In Illinois, your difference between a vet assistant and a vet tech, yes, absolutely, is your education and certificate. Then it's pay as well. So if you want more money, you definitely need to get that education in there because you are going to get paid for that education. As a vet assistant, you won't get as much money because you don't have that education. You also, as a non-colleged person or somebody who hasn't gone in the traditional training for veterinary technology, there's a great deal of academics that are required to understand what you're doing and how it's working. Because when an animal's sick, there's a whole bunch of chemical processes that are going on inside of that body that's causing that animal to be sick. And so you can learn some of that on the job, but really it is that textbook learning that when you do your associate's program that you're getting. So there is a very big difference between a tech and an assistant. So just kind of keep that in mind as you're looking at things. So if you're a tech, where can you work, right? So if you are a vet tech, you can pretty much work a lot of different places, which is really nice because once you have that certification and that degree, it makes you far more marketable. So you can do mixed practices, you can do mobile. Large animal vet, I would tell you guys, the large animal field is hurting. Everybody's really hurting right now with COVID. So this is going to be one of the greatest career opportunities for you as far as getting a job and staying employed. So almost anywhere you can work as a technician that has animals that need veterinary care. So rehabilitation places, there's zoos, aquariums, wildlife centers, research marketing, veterinary products, right? So you could do lab work and make sure that those animals that are being tested and done studies on are being treated fairly and treated well. Techs in the animal labs make really good money. So if you're thinking about, do I want to work with dogs and cats and make like meh kind of money? Or do I want to work with rats and non-human primates and rabbits and work in a lab and make more money? So you have that's definitely something that you can think about. And then of course you can own your own kennel, pet sitting business. That looks great on a resume if you're starting a place, right? It's like, hey, I'm a vet tech. I'm going to start my own grooming, or I'm going to start a kennel. Specialty practices, you guys can get into behavior and do dog animal training, things of that nature. So a lot of different opportunities for you there. Now, when we talk about that veterinary technology specialist, you can have a specialty, right? Like you can focus your education in a certain realm. So after your 2 years, you've already gotten your applied associates of science in veterinary technology. Now you want to specialize. Now you're going to take additional classes. You're going to take more learning, and then you can actually take a board, what's called a board exam, and take an exam that's specifically on those topics for you to then be a specialist. With being a specialist, you absolutely are going to get a little bit more money, and you're going to now kind of have a little niche of where you're going to be able to work. So if you want to be a surgical nurse, right, you want to focus in on surgery, then you're going to go to a facility that is heavy into surgeries, okay? So that is going to kind of base off, your specialties will base off where you want to work. And depending on where you want to work, then you may have to travel. Those of you that are like, oh, I want to be an animal keeper, definitely going to have to be ready to travel because it's a very, very competitive field. So there's not as many jobs in animal keeping as there are, say, in the veterinary industry. So vet industry, I can like go walk down the street and be like, hey, you're hiring? They'll be like, yes, I am. But how many zoos do you see, right? So you have to be willing to be mobile in this business. All right, so how long is your school? If you want an Associates of Applied Science and you want to become a certified veterinary technician, you're looking at anywhere from a 2 to a 4-year program. The 2-year program is going to give you an Associates of Applied Science. So an Associates of Applied Science is very specific to sciences. So you're going to be taking vet courses, like you take vet tech, I'm sorry. Right, not vet because you're not becoming a vet yet, but vet tech courses. So you're going to be taking vet tech courses. That's going to give you, that associates is going to be specific for veterinary technology. I cannot transfer that and get like a bachelor's in biology because I didn't take biology courses. I took vet tech courses. Now there's some schools like Purdue University, they have a 4-year program that gets you a bachelor's degree in veterinary technology. So if you're like, hey, I really want a bachelor's because my parents are pushing me for that, then look into 4-year veterinary technician programs. JJC's vet tech program does work with Purdue, so your credits would transfer to Purdue. So that's something that you could look into if you were interested in a 4-year degree instead of a 2-year degree. So and then are there any school guidelines? It really, you want to make sure that you're going to a school that's accredited by the AVMA. That is going to give you the highest level of your education to make sure you have all of the skills that are required. Right now, we are still in the process of becoming affiliated with the AVMA and the National Association of Veterinary Technicians of America. That's why we're not yet a certified veterinary assisting program, but we're working toward it. So both Mrs. Ritter and I, are working. We just have a few more classes left for our CVT licenses, and then we take our boards. So we're getting close to be able to get you there, but right now we're still just a regular vet science program. So that VTNE is a very difficult exam that the technicians take. So it is the Veterinary Technician National Exam. It is going to cover 7 primary domains and is over about 200 multiple choice questions. So if you think my 50-point questions are difficult, you ain't seen nothing yet, because those are definitely not a open note exam for you, right? So practice now. Trying to think of other fun things that I want to make sure that I share with you, but I'm sure they'll come to me as we go. All right, so what I want you guys to do with this slide is you're going to take the animal and you are going to put the fish. The fish is the vet assistant. I want you guys to put the fish over the square in which you think the vet assistant would do, and then I want you to put the cat over the things that you think the vet technician would do. All right, so wherever you think, they should not all be in the same square though. All right, so that is going to be that slide. Make sure you go ahead and do that. See what you think. All right, so what makes a veterinarian a veterinarian? Oh, nope, I forgot. I'll remember. Not this part, but the other part. So what makes a vet a vet? There's 3 things that make a vet, and they get to diagnose disease, they get to prescribe medication, and they get to perform the surgical procedures. So one of the reasons I show you guys the blood and guts is because the blood and guts is really the primary purpose of the veterinarian. The veterinarian gets to slice and dice, guys. It's the coolest job ever, especially if you don't really want to be about the humans. And if you enjoy being around animals when they're anesthetized, you want to be a veterinarian. If you're like, no, I want my animals to be alive and kicking and well, and I'm going to be a technician. All right, so you are going to kind of play around with that, or think about that as you're looking into if I want to become a technician or I want to become a veterinarian. And I just remembered. So some people will say, Miss Lissy, should I become a veterinary technician before I become a veterinarian? The answer is it's up to you. You're going to take longer schooling if that's the route you want to choose, depending on what college you go to. So if you did just a 2-year associates, so applied associates of science in veterinary technology, and those credits don't transfer over to a bachelor's unless you're going to one of those programs that does, like Purdue, to get a bachelor's degree. You still are going to need a specialized degree. So you take your 2-year vet tech courses, then you need to find your bachelor's and everything else. So you may or may not want to be a vet tech and then become a veterinarian. Some people do it, some people don't. It's kind of what experience you want and how that's going to benefit you. If you're still unsure if you want to get into this career field at all, then you definitely want to make sure that you're shadowing at veterinary facilities. If those bell work pictures are squeaking you out and you're like, oh my gosh, I can't handle this, then this is not the right field for you, at least the veterinary medicine part of it, right? Maybe the animal keeping's okay because you're okay with the vomit and you're okay with the feces and you're okay with the urine. But it is a real, like, it's just the reality of animals. They all defecate. We're veterinary medicine. We're going to see things we don't want to see. And you have to figure out how to cope with that then, right? It's just the way of the world with veterinary medicine. But so your veterinarians, they get to diagnose, they get to prescribe, and they get to perform surgery. So those are the three things that make your vet a vet. Now, education requirements, I'm going to get paid more money. I'm going to be in more debt because I have to go to a 4-year university for my undergraduate degree, right? I'm going to get a bachelor's in something. Cool thing about veterinarians is that they're really looking, when they accept you to vet school, they're really looking for well-rounded individuals. So they want to see that you took a lot of courses in high school. They want to see that you were able to, in college, manage some clubs, organizations, and also your coursework, right? You have to be getting good grades. If you are getting a C or below in this class right now, that is not what you need to be doing in order to get into your veterinary technician schools, or even especially your veterinary and college, right? Because that grueling work starts now for you to be able to persevere and make the next 4 years really easy. So veterinarians do have a 4-year undergraduate degree first, then they complete a test called a GRE prior to being accepted in a veterinary school. So you go from high school, you go, if you're lucky, you finish in 4 years for your undergrad, then you take a test, then you get accepted into veterinary college. There's 26 universities available in the United States for you to become a doctor of veterinary medicine, or a DVM. There's some schools in the Caribbean that are becoming a little bit more popular, where we're finding that people that are not getting accepted to school in the States are going to school down south in the Caribbean, near the Virgin Islands and things of that nature. So that's an option for you. It's a fine option. I know veterinarians that have gone and done their schooling there, and it works out. So it's just pretty much all about what you make it, right? If you're going to sit back and you're going to be like, I'm not really going to do a lot, I'm not going to try a lot, then that's going to be your loss. So being a veterinarian, though, it takes at least, you've got 4 years of undergrad, and then you have another 4 years of your doctor school. So at least 8 years, that's if you're doing everything on track. Okay, so now that you kind of have an idea of the difference between veterinary technicians, veterinary assistants, and then what it really means to become a vet, what you would be doing as a veterinarian, the schooling that you would take on as a veterinarian, the debt you're going to take on as a veterinarian, I want you to consider different viewpoints here, right? So in the head to the left, you are going to write your viewpoint on becoming a vet. So I feel that becoming a vet is a great option or not, and then why, right? So what do you think about becoming a vet? And then the other head is going to be that alternating viewpoint. So what would the other viewpoint be? So if you think it's great to be a vet, why might somebody say it's not great to be a vet? It is not a good idea. And then why? Okay, so that's kind of what you're looking for. So you may think it's still a great idea to become a veterinarian. You may not think it's a great idea to become a veterinarian. So put your viewpoint there, and then put the other viewpoint in the other head. All right, so that's all we have for the types of professions that we have in veterinary medicine. Now we're going to go into being professional, or professionalism. So professionalism in the veterinary facility, we are bound by a code of ethics and ideals that are established by NAFTA and AVMA. And there's actually a veterinary code of ethics, as well as a vet tech code of ethics. And you can find those on those websites. So first thing we're going to talk about with a professionalism is your appearance. You definitely need to make sure you have a clean uniform. Your fingernails, ladies, I'm sorry, they cannot be as long as some of you have them. Nice and short. So you're going to get feces, urine, a whole bunch of stuff stuck underneath your nails. You're also going to have to stick your finger up animals' rectums because you're going to be doing anal gland expressions, and that is not going to be very comfortable for your animal. You're going to have to check gums to see how the color is. So you're going to be sticking your fingers in animals' mouths. Having long nails is not conducive to that environment for you to be working like that. Also, it's going to be easier to spread and catch diseases because then underneath the beds of your fingernails, all of that bacteria, all those viruses, all those things are going to be able to stay there. You do need to make sure that your hair is tied back so it's not getting in the way of things. The animals can play with it. The animals can defecate in it. The animals can bite at it. So your hair becomes a hazard. And you do want to stay away from those dangling earrings, right? Because again, animals can catch in those dangling earrings. So we don't. Okay, so stay away from the dangling earrings. You don't want animals to rip them out, and then you will be bleeding all over the place. So conduct in the workplace. We want to make sure, so when we're talking about conduct in the workplace, it's how are you conducting yourself, right, on a day-to-day. You want to make sure that you're collaborating with your peers, with your coworkers. The last thing you need to do is have infighting and being like, no, I think we should hold the dog this way. Well, I think we should hold the dog that way. Pretty soon you're going to have a dog in two different places and you're going to hurt it. So you need to make sure that you are collaborating, you're working together, you're communicating. You also do need to maintain confidentiality between patients. So you're not sharing names with anybody. So if you have the coolest case ever and you're like, oh my God, I know this person and their dog came, you cannot tell your BFF the name of that dog nor the name of the owner that brought that animal in. So you do need to make sure that what happens at that clinic is confidential. You guys do see images from the vet clinic that I work at, but I never give you names. I never give you any pertinent information that's going to allow you to identify who that owner is or who that pet is, right? So we need to make sure that everything is confidential. You also definitely need to make sure that regardless if you're talking to a coworker and working with your team or if you're talking with a client, you need to stay positive and keep an even tone. So when you are dealing with some stressful situations, you still just need to be really even keel about it and find kind of like just in the back of your head that calming place to make sure that you stay level. The more heightened anxiety or the more like tone in your voice, if you start to get loud, that not only affects the humans that you work with, but it also can affect the animals that are around you as well. So it's best for you to try to maintain as much of a calm tone as possible. And that staying positive, as difficult as it is sometimes, it's imperative. So again, your business and your success of the animal's treatment is going to depend on you and that client's perception of you. So if you start to come at a client because they said something that you felt was rude to you and you're not positive with them, then that's going to show up on a Yelp review. And then pretty soon it'll be on Facebook and then everybody will be talking about it. And then your clinic will no longer be prosperous because you chose to have an attitude with a client. If ever that happens, you can always just walk away, take a deep breath, walk away from it. Luckily, there's not clients in the clinic right now, but you still have to interact with them over the phone. And sometimes people can be a little aggravating on the phone, but that doesn't give you a right to do that, right? So you need to be positive. You need to stay even keel. And just every owner, every client is a new client. They don't know that you were asked 20 times that day how much it costs for an exam. So especially right now, everybody's a little higher stressed. So it's really important to just find that place that you can just find your calm. And that also not just working with your clients, but also with your coworkers as well. You're not always going to like everybody. And nobody expects you to like everybody. So it's almost unrealistic for us to expect that, right? So you just find your work voice. And then you move on, right? You be professional about it, regardless of if you like that person or not. And then you do have to worry about your conduct outside of the workplace, especially our day and age. You guys are TikToking all over the place and Instagram and facing timing and all that random. I don't know, you're tweeting still. I don't even know if that's a thing anymore. I know Miss Leslie's so old. Facebook's like, yay. If you know what MySpace is, oh my goodness gracious. But you really need to watch what you're saying out there. Employers will search your name. They will look at what your social media accounts say. And depending on what you've been posting, they may or may not hire you because of it. So you really do need to be mindful about what you're putting out there for the world to see. You do though, right? So you want to make sure that you're out there. There's a lot of great professional organizations that you can join. So off the bat, you guys all have our @Dove accounts, and there is a nice little community of veterinary professionals there. So you can absolutely engage in dialogue with that community. FFA is a great organization, right? Where you're able to then continue to further yourself in your profession. There's going to be times and opportunities for you guys to attend conferences. So this is where we would continue our education. So veterinary technicians, doctors, veterinary medicine, we have to continue our education. So we do that by attending conferences and get to learn some cool new things. So it's really exciting and fun. And it's also very important when you're not at work that you are seeking healthy ways to manage your stress. Veterinary medicine can be very demanding. It can be very stressful. So it's very important that you find a positive outlet for your stress. So we had done that @Dove about journaling, right? Journaling is a great way to help handle your stress. Some of you guys might have heard of mindfulness practices or just deep breathing exercises. There's definitely stressful situations. We deal with life and death on a daily basis. We deal with people that are not always the nicest. We deal with situations that pet owners bring in their pets and we would not have agreed with the way that they've treated their pets. But you still need to provide quality care. So when you're not at work, right, you need to make sure that you're finding ways that you can de-stress in a healthy manner. Communication. When we get stressed, right, we like to yell sometimes. So we really need to make sure that we're watching our verbal communication when we're with our clients and when we're with our teammates as well. Just because you think something might be appropriate to say doesn't mean that it is appropriate to say. You do have to be mindful that other people have different viewpoints than you. So you may not want to be talking about certain topics in the workplace, and you definitely don't want to bring up certain topics with your clients because you need to be business, right? So it should be business when you're with your clients, especially. And then when you're with your coworkers, keep it professional. You don't need to get all in out of anybody's business, right? Drama is no place in a veterinary clinic. So make sure that you are using appropriate language. Clients can hear you. Oh my goodness gracious. I think sometimes even now the clients are in their car and I still think they can hear us sometimes. So you have to be mindful of that. The walls are thin. If you can hear somebody in your house in another room, just imagine being in a building and having an animal and working with an animal and talking to your coworker, and then clients can hear you. So you really need to just be mindful about what you're saying in the back of house because people in the front of house can hear you. Veterinary clinics are still accepting clients coming in who have to euthanize their animals. And that is a very traumatic experience for those owners. So if you're in the back room doing something and you are loud and laughing and somebody is dealing with the loss of their pet, that is not really a great environment now for that client. So you do have to be mindful of how loud you're talking, what you're talking about, the language that you're using, and making sure above all that you're communicating, right? Make sure that if your coworker, you guys are handling an animal together, you're going to be doing radiographs and x-rays and you're going to be moving an animal. You guys need to talk to each other about when are you moving that animal? When are you going to lift it? When are you going to turn it? Which way are you going to turn it? You don't want to hurt the animal. And that's what's going to happen if you're not communicating effectively. Written communication is also super important, right? We're all pretty good at talking, but when it comes to writing down things, that's where we get a little iffy, right? So it's simple to make errors when we're writing. So we just have to kind of double check things. Nowadays, a lot of your medical records are going to be on the computer, so you have spell check, but you still can't always rely on that. So we will have medical records in paper, we cannot use whiteout. They are legal documents. So your medical records are a legal document. When we are going to make a change on a legal document, what we're going to have to do is take the paper, put one single line through what we wrote, and then initial it. So that is the professional way of how to make a change on a document. We can't scratch it so you can't see it. It's just one line with your initials through whatever it was that you wrote. Whiteout is not acceptable. Crinkling up the paper and throwing it in the garbage because you made a little mistake is also not acceptable. So make sure you're using correct spelling, correct grammar. Also tone, right? Be careful when you're sending emails. We talked a little bit about tone when we were talking about emails earlier. So just be careful that you're not being too blunt. Put exclamation points where it's appropriate, but don't go overboard. Stay away from smiley emojis, depending on the situation, right? But just be very clear and concise and considerate of what is going on in the written communication. Again, all of those animal records are legal documents. All right, so with professionalism, right, I want you guys to fix this image. So we have an image here of a technician walking towards you, and they're saying something. I'm not sure what they're saying. So go ahead and take your pen. You can draw and like circle the stuff that you think's wrong. You can type and say like what you think should happen instead of saying hate that boy. How would you spell that? And should you really even be saying that you hate somebody, right? So go through, draw over, cover the parts, change it. If you can like draw another person of what that person should be looking like to make sure that they're more professional, go for it. That's super fine. If you just want to write and text, use a text box and say, hey, this is what it should look like. This is how you should look. Then do that also. So either one is fine. And absolutely no animals, nor was Miss Alessi hurt in the filming of this image. All right. So I want you guys to reflect on today's lesson. I know it was different, so I'm curious to see how you guys enjoyed it or how you didn't enjoy it. So I want to know what you liked about it. I want to know what you didn't like, what was easy about it, and what was difficult about it. So go ahead and reflect on that. If this works better for us than doing the audio on each slide, then we'll start to do more of these types of presentations. So I need your feedback, though, to know if that's what we're going to be doing. And then, of course, we did Cornell notes. So at the end, we have to have our summary of what the Cornell notes were talking about.